In this video, I'm going to share with you how we can stretch our sternocleidomastoid, also known as the SCM for short. The SCM muscles are two pieces of muscles located in the front of the neck, and it is involved whenever we bring our chin down closer to our chest. It is antagonist to the scalene muscles as well as the trapezius muscles behind. So for some of us with desk-bound jobs, whenever we're looking down, we may start to have tight front neck muscles instead. From time to time, I do encounter some neck disorder patients who complain of a pain on their neck, but after treatment, I realized that it actually is not the back of the neck that's the problem, but rather the front of the neck. In order to stretch the SCM muscle, preferably it will be done in a seated position. For this stretch, it's a little bit more interesting in a sense whereby you are going to be moving your head back as much as you can, and it involves your head going backwards and not you just bringing your chin forwards. What I'm trying to say is that you are going to bring your head backwards rather than your chin forward. It's a different motion, so please try to experiment with this motion first. Once you have gotten used to this motion, you are simply going to bring your head back and bring your chin towards the ceiling. You should feel a stretch along the front of your neck. And once you feel the stretch, hold it for 10 to 15 seconds. You can also make it stronger by bringing your hands together and using the middle fingers, push slightly upwards against your chin. And you should feel the stretch intensify in the front of your neck. Hold for 10 to 15 seconds, repeat 3 to 5 sets. For some people who are doing the SCM stretch, as they bring their head backwards, they might actually feel a slight tension at the back of their neck around the hairline region. I would often suggest for these patients to do a trapezius stretch first before attempting to do the SCM stretch. Chances are the trapezius is also actually very tight, or it can also be due to a lack of motion because of a constant anterior head carriage of. When you're in this anterior head carriage position, the trapezius muscles are not as activated as they should be. Thereafter, when you bring your chin up towards the ceiling, you're going to feel a slight discomfort there. So please take some time, do the trapezius stretch first before you do the SCM stretch. Also, for the SCM stretch, you will notice that I am bringing my head back and not my chin forward. From time to time, whenever I'm instructing this to my patients, they tend to do a chin forward, chin tilt, instead of bringing the head up, such a way that the face is parallel and facing towards the ceiling. So please remember, you are supposed to bring your head back, as you can see in the picture. You are supposed to bring your head back and not bring your chin forward.